Are supplements for kidney health truly effective when it comes to improving kidney function, or are they just a waste of money? Let's find out as we break down the science of the two supplements making headlines when it comes to chronic kidney disease. Chronic kidney disease, CKD, isn't just another health concern, it's a growing public health crisis. With incidences skyrocketing globally, especially in tandem with rising rates of diabetes, hypertension, and metabolic syndrome, CKD's impact is undeniable. Estimates suggest that CKD affects 8 to 16% of the world's population, and its complications can be severe, from increasing the risk of mortality to cardiovascular events, hospitalization, cognitive decline, and even fractures. Recently, there's been considerable discussion surrounding the potential benefits of these two supplements to combat the effects of chronic kidney disease. So sit back, relax, and let's dive into the science behind how these supplements enter the body, get absorbed, and their potential benefits for CKD. Then decide if they truly live up to their claims or if they're just another product of marketing hype. Let's get started with the first supplement. Vitamin D can enter the body through various sources, primarily through exposure to sunlight and dietary intake. When sunlight hits the skin, it triggers a process where a precursor molecule in the skin, 7-dehydrocholesterol, is converted into cholecalciferol, also known as vitamin D3. This form of vitamin D can also be obtained directly from certain foods, such as fatty fish, egg yolks, and fortified dairy products. Now that we understand how vitamin D enters the body, let's explore its conversion process and then explore how it's utilized. Once vitamin D is either synthesized in the skin or ingested through the diet, it undergoes a series of conversions in the liver and kidneys to become its active form. In the liver, cholecalciferol is converted into calcidiol, 25-hydroxyvitamin D, and then transported to the kidneys. In the kidneys, calcidiol undergoes further conversions into its biologically active form, calcitriol, 1,25-dihydroxyvitamin D. Calcitriol is the form of vitamin D that exerts its effects on various tissues and organs in the body, including the kidneys. So now that we understand how it's absorbed and converted, let's see how that plays out within the context of chronic kidney disease. In individuals with CKD, there is often impaired kidney function, which can lead to abnormalities in vitamin D metabolism. The kidneys play a crucial role in converting calcidiol into calcitriol, the active form of vitamin D. In CKD patients, this conversion process may be compromised, resulting in vitamin D deficiency. However, studies have shown that supplementation with vitamin D and its analogs may have beneficial effects on renal health in CKD patients. Research indicates that vitamin D supplementation can help reduce urinary albumin excretion rate, UAER, and urine albumin creatine ratio, UACR, both of which are markers of kidney damage in CKD. Additionally, vitamin D supplementation has been associated with a decrease in proteinuria, a common symptom of kidney dysfunction. Now for the second supplement. Let's dive into the science behind omega-3 polyunsaturated fatty acids, PUFA, and their potential impact on renal health, particularly in the context of chronic kidney disease. Then conclude if these two supplements hold merit as beneficial, or are they just a waste of your time and money? Let's find out. Omega PUFAs are a class of fatty acids known for their numerous biological functions. These fatty acids are not synthesized by the human body and must be obtained from dietary sources such as fatty fish, salmon, mackerel, sardines, flax seeds, chia seeds, and walnuts. Additionally, they can be consumed orally through supplements. Once ingested, omega-3 PUFAs are broken down in the digestive tract into their active forms, including eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, which are then absorbed into the bloodstream. Now, let's dive into the mechanism through which all of this can offer benefits to individuals with chronic kidney disease. Studies have suggested that omega-3 PUFA supplementation may have beneficial effects on renal health, particularly in individuals with CKD. Omega-3 PUFAs have been reported to reduce their progression to end-stage renal disease, ESRD, significantly and consistently. This effect is believed to be mediated through various mechanisms. Reduced inflammation. Omega-3 PUFAs have anti-inflammatory properties and may help reduce inflammation in the kidneys, which is often associated with CKD progression. Improved endothelial function. Omega-3 PUFAs can improve endothelial function, which plays a role in regulating blood flow and blood pressure within the kidneys. Lowered blood pressure. Omega-3 PUFAs have been shown to lower blood pressure levels, which can help alleviate the burden on the kidneys and slow down the progression of CKD. Altered platelet function. Omega-3 PUFAs may alter platelet function and blood viscosity, improving blood flow and reducing the risk of clot formation within the kidneys. Now that we've gained deeper insight into the mechanisms involved, let's quickly explore the connection between omega-3 deficiency and CKD before diving into our final conclusion. Patients with advanced CKD often have lower levels of serum omega-3 PUFAs compared to the general population, a deficiency that may stem from malabsorption, metabolic changes, and loss during the dialysis process. Omega-3 PUFA deficiency has been independently associated with cardiovascular disease in advanced CKD patients. Increasing the intake of omega-3 PUFAs can potentially mitigate these deficiencies, thereby offering another avenue for combating the progression of CKD and reducing the risk of cardiovascular complications in affected individuals. And now, the final conclusion. In conclusion, the supplementation of both vitamin D and omega-3 PUFA presents concrete and promising treatment options for individuals facing CKD. Nevertheless, it's best to consult with healthcare professionals who can tailor supplementation regimes, thereby aligning with the intricate interplay of each individual's distinctive physiological requirements and health trajectory. For your convenience, there will be Amazon links in the description for our top recommended vitamin D and omega-3 supplements. And that's a wrap. We hope you enjoyed this video. If you found it informative or insightful, please give it a like as it helps the channel grow, and consider subscribing for more content like this. Thanks for watching.